number of referrals we've received are above and beyond our expectations at this particular point in time, and we're really pleased with the way that it has been taken up by our GPs.
What I see as the big advantage is knowing that the hospital is getting consistent information, and so they can prioritise and review the referrals in a consistent manner. By doing that, I get more confident, one, that the patient's being treated fairly, and also that I have an acknowledgement that the registration at the hospital has received my referral. So that stops us worrying about faxes curling over and things going missing.
We're also developing specialist referral pathways for gynaecology, and in collaboration with Hutt Valley and Wairarapa, we're developing pathways for both ENT and gastroenterology.
We're looking at an orthopaedic referral pathway here in Wellington, and we've cut it down to 5 pretty quick questions around hip and knee replacement. So this is a work in progress, but it will be of great interest. I guess blue sky thinking about that is to say, having a form which will do the prioritisation for us and let us know whether this patient is likely to be accepted for a specialist appointment or not, and then giving us appropriate alternative pathways for referral. For example, if a patient isn't going to meet the criteria for a knee replacement, having that referral go through to the physiotherapy department at the hospital would be very helpful.
From a DHB point of view, our administration staff are finding it much easier to process the electronic referrals as they come in a standard format and can be easily entered into our patient administration system, and also it allows them to be sent electronically to our specialists for triage if they choose to use that method. Our specialists also like the referrals better as the data is in a standardised format, so they know exactly where to go to for any particular bit of information that they require. One
feature that we will be using more and more is the request for advice. Very often referrals are sent through to the hospital and perhaps they don't really need to be seen, or if we were to do a little bit more investigation, perhaps it would make the patient's path through the hospital easier. What we need to do is have a secure way to message to our colleagues in the hospital, and for them to have a secure way to message back to us, where those messages are integrated both in our computer system and in their computer system. We know that standard email is not suitable for medical communication. It's not encrypted. Using eReferrals is a way to really streamline the flow of information and hopefully make things once again better for our patients.
We're now getting really good information from electronic referrals for planning, which allows us to see which services have the highest volumes of referrals. It also enables us to see which referrers also have the highest volumes of referrals. We can see when those referrals arrive by day of the week, by time of day, and also by specialty, so it allows us to make much better planning decisions in terms of how we'll manage our outpatient services.